You can go. You're live. Hello, everybody, and welcome to Fibroids, a community response, part of our Your Voice and Health Research Summit for Clinical Trials Week 2026. My name is Dr. Giovanni, co-founder and co-director of Prober, and I will be hosting today's session. First of all, thank you so much for spending your evening with us. Conversations like these matter because healthcare is not just about statistics, prescriptions, or hospital visits. It's about lived experiences, unheard stories, and communities finally feeling seen and understood. Tonight's discussion focuses on fibroids, a condition that affects millions of individuals globally, yet still remains under discussed in many communities. Women's health conditions are often misunderstood, minimized, or dismissed as normal pain for far too long. We're also living in a time where conversations around conditions like PCOS are evolving. Many of you may have heard of the terminology called around PCOS, which is polycystic ovarian syndrome, and it's changed the terminology internationally, and now it's called polycystic ovary metabolic syndrome to better reflect the broader metabolic and hormonal impact of the condition rather than focusing only on ovaries. This shift reminds us how important it is for healthcare language, research, and awareness to evolve alongside patient experiences. About the session, today is not a lecture, it's not a medical exam, and nobody will be tested at the end, thankfully, except we will have a quiz for any lucky person to win a Prober merchandise kit. This is a space for open conversation, storytelling, awareness, and reflection. We'll spend around 30 to 40 minutes hearing perspectives, discussing community experiences, and exploring why conversations around fibroids and women's health needs more visibility. After that, we'll open the floor for a live Q&A session where you're welcome to ask questions, share reflections, or simply listen. So now it's my pleasure to introduce Candace Bryan. Candace is a health equity strategist and program architect who is deeply passionate about improving health equity, amplifying underserved voices, and creating meaningful community-centered healthcare conversations. Today, she'll be speaking on fibroids, a community response, exploring both the lived realities of the broader social and healthcare impacts surrounding fibroids. Candace, thank you so much for joining us today. The floor is yours.
Dr. Giovanni, and to your team, thank you so much for your kind invitation to join, and obviously to our viewers as well. I hope everyone's doing well. Thank you so much. Next slide, please. So my name is Candace Bryan, and I'm grateful first and foremost to my ancestors and to the Creator for being here to speak with everyone today. So a little bit about me. I was born and raised in Harlesden, northwest London, and my Jamaican mother came here as a child of the Windrush generation. And my father, who is now my beloved ancestor, was Bajan from Barbados. But he was definitely Jamaicanized by my mum. So yeah, I'm a mother of two wonderful human beings. My son is 21 and my daughter is 16, currently sitting her GCSEs along with many other young people across the country. I'm a sister to many and a fiance to one, who have all supported me on my journey that I'm going to share with you today. And I help NHS and public health organisations and community wellbeing groups to design and implement effective, equitable, and culturally competent health interventions that build trust, access, and ultimately improve health outcomes. And my journey in this space started when I realized structural inequalities in leisure opportunities for Black communities almost about 20 years ago. And it was my BA Honours in Leisure Management that really helped me to pin the understanding that cultural identity is a structural determinant of health outcomes and not just a social footnote that maybe the system is also not so neutral. So after I founded Noir Wellness in 2016, I decided that I was going to do my master's in public health and wellbeing to help evolve that organization. And at the moment, I spend my days working as a public health strategist for a North London Borough Council. And in the night, I am evolving into my wider role as a health equity strategist, program architect, and keynote speaker. Next slide, please. So I've spent nearly three decades navigating a complex gynecology health needs. And I want to kind of share that this is the third time that I'm publicly sharing my story. And in all honesty, it's a journey that typically I only share within my support system. But I think the main reason for sharing is that I've spent almost 20 years designing solutions. This is primarily because the system has failed to provide them for underserved communities. I'm the creator of the UK's first 12-week fibroids health education program for Black women, the first, and I'm very proud at being able to contribute to a body of research that I believe is missing. Next slide, please. But what counts as evidence? And I believe if we want to close the health inequalities gap, we must stop expecting patients to become medically fluent. Improving health literacy, yes, of course, but we must start demanding that our clinical and research organizations become culturally concordant. And what do I mean? What do I actually mean by culturally concordant? It's essentially when a patient and healthcare provider share the same cultural background. And this is because evidence does suggest that concordance can improve patient satisfaction, adherence to treatment, and health outcomes, particularly for groups who have faced systemic racism. Next slide, please. So Clinical Trials Week is, as Dr. Giovanni has said, it's all about the future of healthcare research. And today's session asks a harder question. Whose knowledge shapes that future? And whose experience is actually treated as data? Next slide, please. So this evening, next slide, please. Thank you. So this evening, as you eat your healthy dinner, I hope, I want to take you through my journey of how I've been navigating a system that hasn't necessarily been designed for me yet, and many women who look like me. And I want to show you why structured education for Black women is essential, and the program that I designed for Black women. And then together, I really would love for us to look at the findings and then end with a call to action. Next slide, please. So let's start here. The burden of proof and also my truth. New slide, please. Next slide. Thank you. So I guess my journey started at age 16, but at the time, I never once imagined that I would be on a journey of navigating healthcare in the ways that I've experienced. Like, I never thought that this would be a journey. I just thought it was a one-off appointment, something was happening. And primarily because typically women, girls are told, oh, it's normal. Your pain, your symptoms are normal. For me, I suffered with terrible pains, often doubled up on the floor, vomiting each month. And my comfort certainly was, and probably still is, chocolate and music. And I know many of you can relate to chocolate. Not so healthy, I get it, but that was my comfort. And after years of complaining and no changes, my mum decided, if them no one refer you, we are going to go private. Translation, if the healthcare system won't refer you, then we're going to go private. I'm going to take you to a private hospital instead. And I was fortunate that my mum did that for me at the age of 16. And so that's what we did. And it was here where I was diagnosed with mild endometriosis. I remember when I said earlier, like I never knew that I was on a journey. And when I look back, I don't even remember actually being treated for endo as it's kind of known now. It's kind of got a little bit of a little bit of, a little bit of, what's the word? Momentum, if that's what you want to call it. But I do recall a number of times being advised to consider contraceptives, which I just never ever believed in, especially at the age of 16. And I honestly believe that my lifestyle changes, such as increasing my exercise. I started off in a gym environment, even though I hated PE. My first role was working in a gym, and through working in a gym, my love of dance, fitness, and exercise became apparent. Also, reducing alcohol in my later years when I was at uni, and also giving up smoking, I think significantly reduced those symptoms. But I do think also giving birth to my children in 2005 and 2009 almost removed my symptoms entirely. But then in 2016, something changed where I was found to be iron and vitamin D deficient. And during that same year, ironically, I launched Noir Wellness, which we'll hear more about later on. But in 2022, my health was deteriorating. And in my heart, I know that the traumatic and stressful events that led to my dad's transitioning in May 2019 definitely played a significant part in my health decline. So I was admitted to hospital with severely low iron and later had two small fibroids confirmed. And this is where the cycle of scans, iron infusions, biopsies began. But for me, as I said, I'm very, very proud of my African Caribbean heritage. I decided that I would support my fibroids healing journey through ancestral herbal practices. And doing all this all whilst holding down a full-time job, supporting my family. This took a toll on my relationships, my quality of life. My low immune system contributed to many days off of work. And, the low iron, even now, leaves me with headaches, brain fog. But I still didn't even make the link. I still didn't think I was on this journey. I thought, it will come to a resolve soon. And so even though I had even launched the fibroids health education program just a year before, where you see me sitting there, I still didn't realize that I was on this journey, which I still am now. And I hadn't at that time quite sort of learned the art of putting myself first. And so fast forward to today, I've recently returned to work after being off for about 11 weeks of long-term sickness leave, the first in my whole entire career of actually being off of work, long term. Thank you. And on Tuesday, just this week, I had another endometrial biopsy. And for me, this was a significant milestone. And the reason is because when I had my first one in 2022, it was the most traumatic experience I'd ever had. And this is after even giving birth to my two children. That's not to say, bringing my beautiful babies into the world was traumatic. It's just to say, my first experience was horrible. And this time, I'm incredibly grateful for Dr. Nina Cooper at Northwick Park Hospital. She was so caring, so reassuring, so compassionate in her approach to my journey. She asked me about my previous experience. She even apologized, which had me in tears. And as you can see there, I then just smothered her with a hug. I don't think she knew it was coming. And I'm just really grateful that there are times when, I sit in consultation rooms and I really feel like I'm being held, not just heard, but actually held. And shout out to Dr. Nina Cooper, because you're the girl. You're definitely the girl. Next slide. Thank you. So for many women, the journey continues. And I want to add that I have huge respect for healthcare professionals and the work pressures that they are facing, especially now with all of the changes that we're seeing across the sector, across the system, politically, and so forth. My journey isn't about blaming people, it's about recognizing where systems can better listen, how we can work together, and how we can respond and support women, and particularly Black women, with dignity and also cultural understanding, and really just be Dr. Nina. Like, yeah, if you want to be, be someone, be Dr. Nina, and engage and talk. I'm sure she came away from that session, that consultation, with a lot more insight for how I was sharing my journey, and I felt comfortable doing so. So there's data there as well within these consultations. Okay, so I think it's I mean, I've leaned into some of these points already. I don't want to kind of labor them, but essentially, for me, it's it's almost like when I speak to sisters, it's like, you never guess who I opened up my legs to today. It's such, having transvaginal scans repeatedly, for me personally, it's so violating. It's not something that I want to do. I don't think it's something that any woman wants to do. And it's that kind of, when you're looking at how it impacts, people like me, people who look like me, women, all women, it's physically, emotionally, and it's systemic, it's taxing across the board. It's violating, navigating the emotional burden with no sort of coordinated care plan. It can be so taxing. And yeah, but there's hope. So I'm not going to dwell, we're going to move on. But especially when we work together, there is hope. So in terms of, what I did next, in 2016, as I said, I launched Noir Wellness, which was essentially inspired by Africa and the Caribbean, to provide a wellness service to communities in Northwest London. And we originally set out to focus on 5 key health conditions disproportionately impacting the Black community. And they namely were obesity, dementia, maternal health, the mental well-being of young people, and of course, fibroids. Now, I wanted to play a short clip to kind of give you a flavour of what we did to engage Black communities living in Northwest London, but we're unable to play that via StreamYard. But essentially, what I wanted to share that video to kind of demonstrate just the amount of how important our environments are, and how that adds to building trusts within communities and creating trustworthy spaces where people can just be free to be themselves. And one thing I do strongly believe is that sometimes when you have, not even sometimes, you have underserved communities, and I'll speak about my community. And so Black Caribbeans and Africans in this country, from my perspective, are always, or the majority of the time, are having to enter into spaces that are not culturally concordant. So for example, whether it's the school system, so when we think about the wider determinants of health, when you think about the school system, or you think about the workplace, or you think about your shopping center, even your leisure center, you're never really served by somebody who looks like you. And so that also becomes taxing, especially when we already know that racism is a public health issue, and weathering is also quite damaging to our health. So when you create these spaces where people look like you, who are highly qualified, they're in a relaxed state because they're now in their leisure time, I think the trust element is such a powerful thing when you can get that environment right. So I really wanted to play that video for you so that you can hear some of the testimonials, but I can share the YouTube link maybe later on in the presentation. So if we move on, that was the video. So thank you. So in the summer of 2016, we hired a space and we ran multiple sessions over 12 weeks, and we reached just under 300 people. And we supported 21 brands, which led to a really solid, and I'm very grateful for this partnership. And I hope that Abby's online this evening. But it led to a partnership with Lake Health and Wellbeing, formerly known as the Lake Foundation. And through our partnership with Abby and her organization, we've begun to understand more about fibroids. And it's been quite a journey since that time. Next slide, thank you. So what we learned is that Black women are 2 to 3 times more likely to have fibroids than white women. We learned that symptoms would appear at a younger age in Black women, and often larger and certainly much more aggressive. And later recognized that it was emerging as a public health issue and not just a gynecological issue. So this slide is a bit busy because essentially we have been busy since 2016. But it was in 2017 and 2018 that our focus seemed to really shift from the other 4 health inequalities that were impacting our community. And it shifted entirely on fibroids when we hosted the first fibroid series, which is essentially is an all-day event, which pretty much had various different workshops, holistic, and a holistic approach. So we would have, in fact, I'll come to it a little bit later. But these all-day events in Harrow and Brent drew women who had never found that space that I was talking about. They never found that space where they can speak about their experience, be held, be supported by sisters, by women who look like them. So we would spend the next few years pushing for change, as you can see along that timeline. International Women's Days for two years running. We launched also a Global Fibroids Alliance, again with the Lake Health and Wellbeing. And we were working with organizations across the globe. And again, I wanted to show you another short clip, which was from our 2017 Fibroid Series all-day event. And that one took place in Harrow, but yeah, unfortunately not able to. Thank you. So this one is just an image from the following year in 2018. So this one was in Brent, Northwest London. And here you can see one of the practical workshops, which was delivered by a sister from the African Caribbean community again. In fact, that is, I think, Louise Sam, who actually migrated to Barbados, as did Lake Health and Wellbeing. Abby also migrated to St. Kitts, just a side note there. But, this shows that the demand was there. Women weren't just seeking clinical information, they needed that holistic support, which we were able to provide. Okay, so what we then did was, with the feedback from these events and also informal conversations, this heavily informed our next steps. What we found is women would often say to us, we need more, one day is not enough. There was a point where both Abby and I, we wrote a full-scale sort of sponsorship package which would enable us to actually take women away on a retreat, so we can spend a full weekend with them in a relaxed environment with practitioners, with a multidisciplinary team that would serve them, would hold them, and would hear them. But we didn't quite, we wasn't successful. But yeah, there's still hope. Thank you. So even though I became aware of the data, I never, still not connecting my own menstrual challenges. And even though I'd been designing the program and helping other women, I buried my own journey through wanting to support others. And even today, as I said, I'd still rather not talk about my journey and just simply focus on the solutions. So I've mentioned it a couple of times, but I want to just take you through what it looked like. So in 2021, you can see here, this was I think it was a Facebook header, but it was basically our flyer. So this was the first 12-week online fibroids health education was born, essentially. So as I said, designed by Black women, for Black women, with a multidisciplinary team drawn from the African and Caribbean community. And, I think I'll come to it later, but we used knowledge that was evidence-based to support women with fibroids, the diagnosis, treatment options, and self-management, and again delivered in a culturally relevant context. We had the reggae playing, we had the food, that looked, and things that were all familiar to us. Yeah, so we talk about the trust, we talk about being free, we talk about being relaxed in that environment when you're trying to manage a really difficult health condition. We looked at, we included diet, movement, African yoga, which you would have heard on the video, breath therapy, dealing with stressors, dealing with stressful events, mindfulness, indigenous herbalism, which I found very insightful, emotional well-being, and again, just addressing the whole person, not just the uterus. Peer support networks, we shared decision-making skills and access, as I said before, to a multidisciplinary team, which essentially would build the capacity for people to advocate for their self within the NHS. Thank you. So just in terms of the curriculum and some of the relevant resources, so the program aim was essentially to assess the feasibility and acceptability of a structured, culturally sensitive fibroids education program for Black women. So this was delivered over 12 interactive online sessions between May to July in 2021 with 25 enrolled participants. Next slide, please. So in terms of, what we did with the data that we collected, we did pre and post intervention design to evaluate the program. We used baseline surveys, focus group interviews for people who are comfortable to share their story and give us feedback, case studies, and also participants were recruited from multiple channels. So in 2017 and 2018, of course, we had a list of women who already said to us they wanted more. So we were able to invite them onto this program. We also did some advertising on Facebook. It wasn't targeted. It was just, I think it was just quite open. And leaflets and flyers and word of mouth. And of course, the inclusion criteria were Black women of African and Caribbean heritage, those with confirmed or suspected diagnosis, and self-reported limited knowledge. And we obtained consent via registration, Google Forms, and an initial assessment from a member of my team. And here, just very quickly, I just wanted to show you, some of the resources that my team and I created together. We did a fibroids guide. You can see there top left, and also bottom left. You can see a couple of screenshots from the videos from the practitioners who delivered those sessions. Top right is our leaflet, and at the bottom there you can see some recipe resource cards. And just the final thing on this slide, we had a post-program support group which enabled women to again continue to feel held, and that support group still continues today on WhatsApp, and we host quarterly meetings. And one of the things on the program that I'm really proud that we offered was mental health support. So each woman that came onto the program was offered 2 free, I think it was 30 minutes or 1 hour sessions to spend with a mental health occupational therapist to just discuss whether they needed more support. So again, a little bit busy here, but of course there were limitations to this program. So technical barriers, some participants faced digital challenges. And so we would certainly look to provide technical support from the outset. We only did it via online delivery, which really did limit that kind of connection that we definitely saw in 2017 and 18 in terms of the in-person events. Of course, it was only 25. So in Public Health Speaks, that is a small sample size, which limits, the generalized ability of the program. And so in terms of scaling the program with a larger diverse cohort, that would enable us to have a wider reach. And although the program support group continues, we've not been able to do any longer term follow-up. And so beyond the program completion, we're not able to assess, and build on that. We have had only I think maybe 2 women who have actually left the group, and they've kind of said, one I remember had a hysterectomy, the other woman kind of said, I just wanna focus on everything positive. Although the group is positive, I just wanna be free essentially. But they've always said they're happy to come back and support, the next phase of this work. So some lessons definitely to be learned here. So what the participants said, I think it's a little bit, I think through StreamYard, you may not be able to see that, but again, 100%, we had a 100% completion rate. 100% of the women agreed that the knowledge would help them manage their fibroids. And also more than 90% felt that they were well informed about lifestyle practices post-program. And this compares to what's been reported nationally with fibroid treatment information, with 62% of women saying that they're dissatisfied with fibroids. So again, the data has a voice and deserves to be heard. So here are some, quotes that we took from our focus group. This program has helped me to prepare for my surgery and lifestyle changes afterwards, which I didn't have in 2015 when I had my first surgery. In the middle there, during the process of learning, I've had the confidence to deal with my surgery in a confident way. And then it's been an absolute fantastic and inspiring. I feel truly blessed to have come across this program. And these are not just testimonials, they're evidence of what happens when the system finally meets women where they are. And another quote here. Again, I think it just shows that when Black women are supported in a space that's designed for them, they will complete programs, they'll feel empowered, and they'll move from managing their condition to really reclaiming their lives. So I've done a lot of work here. So this is the call to action. No pressure, but essentially I wanted to, Dr. Giovanni, I wanted to really challenge the room and say, if you're a researcher, if you're a funder or a commissioner in this session today, whilst eating your healthy meal, I must add, what would it mean to treat a 12-week community education program as a clinical intervention worthy of a randomized controlled trial, or just worthy of really embedding and upscaling alongside you? Innovation to me looks like redesigning the care pathways to be culturally concordant, funding community-rooted educational interventions. And I need to pause here to say, Noir Wellness, what we did, whilst it was the first 12-week health education program, there are many organizations who are doing the work. And I believe they're doing the work because of this gap, and because of lived experience has forced them to become medically fluent and to fill a gap and desperately help themselves. And then when they get to a point, they think, do you know what, I'm going to help other people. So there's many organizations, who are ready, I believe, and willing to do this work. Commissioning holistic models alongside clinical care. And, what holds the innovation back is a research agenda that privileges pharmacological trials over educational interventions. Commissioning frameworks that fund generic services and call them equitable. And unfortunately, the absence of nice guidelines that essentially would give commissioners the mandate to act. So firstly, I just want to say this is not a pitch, it's an invitation. It's an invitation to researchers, commissioners, and policymakers to consider what becomes possible when lived experience is treated as a foundation of evidence, but not a footnote to it. Next slide, thank you. So again, if you're a researcher, commissioner, or a patient advocate, I'll start with the patient. Know that your experience is evidence. Demand that is treated as such, and find spaces like this one that demand that you're heard. If you're a clinician or a commissioner, be like Dr. Cooper. No, but ask whether the services you fund are culturally concordant or simply culturally diverse in their marketing, and advocate for nice guidelines on uterine fibroids. And if you're a researcher in this space, design your next study, as it says there, with community co-production at its core, and fundamentally ask who is missing. Who are we missing from your trial cohort, and why, more importantly? Next slide, please. I think that brings us to the end. If you'd like to connect with me, please scan the code. I can be found primarily on LinkedIn. Thank you very much for listening. I'm very happy to take any questions. Dr. Giovanni, let's talk.
Oh, yeah. Can you hear me?
I can hear you.
Yeah, this was a really informative session. I enjoyed it, and I learned even more about fibroids, and I hope everybody else enjoyed it. Um, I'll ask some questions. So, I guess when you started your program, did you find that it was a slow start, or did you find that there was an immediate interest in, I guess the program that you were trying to create in order to get more women involved and to discuss more about conditions and to find a solution?
It's a really good question. Thank you. So essentially, it was a organic build up. So it was from the model for Noir Wellness. Essentially, was when we hired the space, we were getting people in through the door via dance fitness, via reggae aerobics, or something of that nature. After each physical activity session, we would then invite a guest speaker in. And on this occasion, it was Abby from Lake Foundation, formerly known as the Lake Foundation, who gave her talk on fibroids. And then we would end with some canapes or African Caribbean inspired food that related to the same health condition that we would speak of. So it's from there that the interest started, certainly from our team's perspective. But the conversations that happened even in that small session then enabled us to work with Lake Health and Wellbeing to understand what the disparities were. And then we moved on to hosting 2017 and 2018 sessions. So from those sessions, that's when we realized that it was a demand. So in essence, once when we had created the program, we were already creating it based on the feedback. So we wanted to, close that loop and go back to those same women to say, look, we listened to what you said, and this is what we've created. And also, notwithstanding, Dr. Giovanni, in 2020, we had the lockdown. So essentially, we had to kind of think about different ways of delivering. First, it was, an annual event just wasn't enough. What happens to the next 11 months? We knew these women needed support. And so actually, when the pandemic happened, we were able to then say, okay, people are very used to being online. It was just a natural sort of progression. But I feel the demand was there.
Yeah. I mean, definitely, I've spoken with a lot of people, like from clinicians to patients just like you, that have talked about fibroids. I even did, like a mini research myself, and how a lot of the time doctors do miss how much fibroids people have. There was someone, you probably may know her, Dawn Heels. Yeah, so she's a big advocate for fibroids. And I know, when I spoke to her briefly, we spoke a few on different occasions, and she told me how she was told she probably had like this amount of fibroids, which was less than what she actually had. She actually had even more than what they thought she had. And, you know, yeah, like she talks about her story, so I won't like go too much into it, but you guys can obviously go in on her LinkedIn and see what she talks about. But basically, the whole point of that was just it's not taken serious as it should, with other conditions, or at least with people that are complaining about it. They're not taking those patients serious, because they're finding that they're having to go back, readmitted, getting surgeries again, and getting new treatment, and they're still not getting the quality of life that they want. So, yeah, very, very informative. And thank you.
Absolutely.
Mhm.
Yeah, sorry, absolutely. And so when I talk of lots of organizations, Dawn Hills runs the guidance suite. And that's exactly what I mean. Organizations are doing the work. And in terms of, healthcare professionals, gynecologists, GPs missing things, I do think there's space for training and development in that area. So, it's kind of looking at both sides of the coin. If healthcare professionals don't have the knowledge, then how are they going to care for patients who sit in front of them? So it's what can we do to support and improve the training and education that GPs or GP trainees at the very start of the open door, if you like, the training that they get, which then can be cascaded to gynecologists and BARTs, NHS Healthcare Trust. They're doing amazing work. There's a fibroids and study centre that's emerging, and they do exactly that. They're bringing clinicians along and upskilling them to develop their knowledge in this area. So I think there's definitely two sides of the coin there, and they are as equally important.
Yeah. So we have a comment and question from Love is Bliss. And I love the username, by the way. So I'll read it out to you. It says, "Thank you for that very informative and inspirational talk, Miss Bryan. I understand also that you have recently been nominated again for another award this year. Do you believe that generally we have to take matters into our own hands regarding our health and well being as a community so it may be taken more seriously?"
Firstly, thank you for that question. And yes, I've been nominated again for an award, and I'm very grateful for that nomination.
Congratulations.
Thank you so much. I I do believe we have to take it into our own hands. So, kind of leading back to that point about particularly for African Caribbean communities and having to go into spaces, we often see a lot on LinkedIn or across. There's just so much injustice, put it that way, to our community. We've seen, I won't even name what's been happening this week. And so, yeah, I do believe we do have to take it into our own hands. And more importantly than that, I believe that we have the skill set. We can do this. You know, we have the knowledge. You're seeing the emergence of, the Black Medics Association. I hope I've got the name right. The Black Caribbean Doctors and Dentists Association, who actually also delivered a session on the fibroids program. There are so many organizations and charities that are forming, that are bringing together collectives of professionals, because I think in this time what we've got is, you've got the Windrush generation, but you've also got people like me who have been born here, who have gone through the education system, notwithstanding that actually education in Africa or Jamaica is just as, or even better than here. But what I'm saying is, we've lived the experience of being here, and we're able to serve our communities. We're able to have that cultural concordant service. And that's not saying sometimes I may be faced with a Black woman, and it may be awful. However, what I'm seeing across the sector is that when we do take it into our own hands, the outcomes seem to be much better, and the trust is being built much quicker.
Amazing response. So we'll take some more questions, but as you guys are formulating your questions and thinking about it, I'm going to do a quiz. And this quiz, it's going to be, it's not going to be that long and hopefully not too tricky. And this will be for winning a Prober kit. So whoever answers that, I guess if you have a unique username, you will have to put like maybe your LinkedIn name, or maybe you can contact me on LinkedIn or on Eventbrite with your email, and then we can get that sorted. But the question that I'm going to ask, and this is, I guess, whoever answers it first correctly, Candace will verify if it's correct, not to put too much pressure on you. So we can do one question, or we could do two. But the first question is, this is a true or false question. Fibroids are cancerous growths. So whoever can, I guess, answer that first, we will, yeah.
Dr. Giovanni, I can't see the comments.
Yeah, unfortunately, only I can see them on my end. But if you were on the Vimeo side, because that link, you'd be able to see the comments for that side, or if you go on the LinkedIn as well. Yeah. So let me see. I think I received a new comment. I'm just waiting for. Let me just check.
I was going to say, can I join in? I'd like to win, but it's okay.
You're definitely going to get a kit for sure. Let's check. Let's see. Okay, so we have someone who already replied, and they said false. Did they get it right?
However, I must declare I'm not medically trained. So yeah, just a caveat there.
Yeah. So yeah, false fibroids are cancerous growths. Yes, you are correct. And to elaborate more on it, fibroids are non-cancerous growths that develop in or around the uterus. So congratulations, Rosalind, on this. Okay. And then we also have another comment from Love is Bliss. She said, thanks, I do too, because of self love is a healer, right? Yes, I love the leadership and confidence building elements of the support you have created. Thanks again. Okay. So I think that if there are no other questions, I'm going to check on LinkedIn just to make sure. If there are no other questions or comments, then we will conclude the session with a word for myself. So, unless if you have anything else to add, Miss Candice Bryan, I will do the closing remarks.
Just say thank you so much for inviting me to be part of your Clinical Trials Week. And also thank you for everyone who joined the session. And I look forward to connecting and continuing the conversations afterwards.
Yep. Thank you. As we come to an end to today's session, I wanted to thank everyone once again for being here and being part of this conversation. To Candice, thank you so much for sharing your expertise and perspective so openly. And to all of our attendees who have been here all week or who have just started to come today, thank you for listening, engaging, and helping make conversations around women's health more visible and more human. At Prober and through Your Voice in Health Research Summit, um, we truly believe healthcare improves when communities are included, heard, and empowered. Thank you, and we hope to see you all at our upcoming clinical trial session. So we have the live stream tomorrow of the Leads in-person event. So if you did get the webinar ticket, then you will get a notification for the live stream tomorrow. And that will be a treat because you'll get to see the amazing live action. You'll get to see community members, clinicians on stage discussing things, and we will ensure that the live streamers will be involved as well. So if you guys do have questions, we will be sure to include you in it as well. Thank you guys so much. And Love is Bliss wrote another comment. Keep going strong. Thank you so much for your amazing engagement and kind words. Without further ado, we're going to end the live here. If you guys do have any questions or anything for Miss Candice Bryan, her QR code is there, so you can screenshot it and it will work on your phone, or you can just find her on LinkedIn with her name displayed on here. Thank you, guys, and have a great night. Bye. Okay, we're ending.